Hi, everyone. My name is Lori Hendren. I am the Associate State Director for AARP Illinois. I'm joined and privileged today to have Courtney Hederman with me. She's a fellow Associate State Director for AARP Illinois. And we want to welcome you to this very, very important conversation about insights for family caregivers and especially this holiday season. Today, we are on live with the Illinois Long-Term Care Ombudsman, Kelly Richards from Chicago. Hi, Kelly. And we will be discussing how you can continue to care for your loved one during the pandemic and the latest news regarding essential caregivers in long-term care facilities. We will also be addressing your questions and comments posted throughout this conversation on the Facebook and YouTube feeds.
Thank you, Lori. So again, my name's Courtney Hederman, and I'm really thrilled to join you and Long-Term Care Ombudsman Richards for today's conversation. I encourage you and everyone to get your pen and paper ready to write down all of the important phone and web resources you can access to get continuous updated information about all the resources we're going to share, but for you and for your loved ones. If you'd like to ask a question anytime during this live conversation, please post your question or comment in the Facebook or YouTube feed. This will place your comment or question in the queue for us to discuss live. As you may know, AARP is a nonprofit, nonpartisan member organization. It's been working to promote the health and well-being of older Americans for more than 60 years. And in the face of the coronavirus pandemic crisis, AARP is providing information and resources to help older adults and those caring for them to protect themselves from the virus and prevent its spread to others. If you'd like to stay on top of the most recent and up-to-date information after this call, you can visit aarp.org/coronavirus. Or you can visit coronavirus.illinois.gov. You can also call the AARP Illinois Caregiver Hotline at 1-844-226-1190, where our live operator, Sonia, who is lovely, she's available from 9 to 5 p.m. Monday through Friday and is happy to listen to you and your family's care challenges during the pandemic. Your stories and those of your loved ones, with a signed release form from you, will empower our advocacy efforts to improve the status quo for your loved ones in long-term care facilities. So right now is your opportunity to learn, ask questions, and get answers from Illinois State Ombudsman Richards on how to care for your loved one in a long-term care facility during the pandemic. Back to you, Lori.
Thank you, Courtney, and thank you all for joining us today. And again, please put your comments in the feeds. We're going to definitely address those. AARP is very fortunate this afternoon to have joining with us Kelly Richards. She is Illinois' long-term care ombudsman, I believe coming to us live from Chicago. Correct me if I'm wrong. And thank you, Ombudsman Richards, for joining us today, taking the time what I know is a very hectic schedule, and welcome.
Thank you. Thank you both, Lori and Courtney. I'm thrilled to be here today to share a little bit about the program and answer some of your questions. As Lori indicated, my name is Kelly Richards, and I'm the State Long-Term Care Ombudsman. I'm in charge of the Long-Term Care Ombudsman program that advocates for residents in long-term care facilities throughout the state. The state program is made up of 17 regional ombudsman programs throughout the state. As ombudsmen, we serve as advocates and not regulators. We work to answer questions and respond to complaints made by residents, family members, and others, and sometimes even facility staff. Most of those complaints are related to residents' rights. One of the things that makes our program very unique is that regardless of the source of the complaint, the resident is always our client. We have strict confidentiality rules, and we work to maintain a resident focus in all that we do. We also have another program called the Home Care Ombudsman Program. And these home care ombudsmen work to resolve complaints for participants living outside of long-term care facilities. They work on complaints related to home and community-based services, waiver program, or services through the Medicare and Medicaid Alignment Initiative.
Wonderful. Thank you, State Ombudsman Richards. And real quick, before we get any further, I want to repeat this. Is there a number that individuals, as they're listening to this, can write down to be able to contact you?
Sure, absolutely. They can contact the senior helpline to get to me. That number is 1-800 252-8966.
Wonderful. Thank you. And thank you for joining us. And I would like to remind all of those friends that are joining us, thank you so much. We appreciate it. On social media, if you're with us on YouTube or Facebook, write your questions in there. We're monitoring and we're seeing them pop up. And this is going to be a live conversation, how you're caring for your loved one during this pandemic. And we welcome your comments.
All right, so let's get to some questions. I'll go first. So State Ombudsman Richards, according to the Illinois Department of Public Health, there have been essentially around 55,000 COVID-19 positive cases among residents in Illinois facilities, and sadly, nearly 7,000 deaths. These are extremely scary and challenging times. So during these challenging times, how can your office help family caregivers connect with their loved ones in nursing homes?
Sure. So ombudsmen have been working very diligently over the past several months to advocate for residents' rights to communicate with their families and friends. We see a whole spectrum of facilities who have tried to prevent window visits, to situations where facilities aren't assisting with virtual visits, to facilities who are trying to prevent compassionate care visits. I would like to point out that IDPH has clarified that window visits should be allowed regardless of the level of tiered mitigation. There's the Illinois Long-Term Care reopening guidance that clarifies that facilities are expected to make video conference available to residents. And if anyone is interested, that reopening guidance is on the IDOA website under the Ombudsman tab under COVID resources.
Okay, thank you. And we just abbreviated that for viewers. I'm going to leave that up for a minute.
Yep, great. Thank you. So on just another question. So on December 2nd, the Illinois Department of Public Health released guidance for essential family caregivers and long-term care facilities. So as we know, visits are going to look different for a while. You made reference just now to window visits. So, but AARP wants to ensure anyone with a loved one in a nursing home or any other long-term care facility that there is information they need to do to prepare for an in-person visit, period. So so my question is really, can you help viewers understand under the new guidance who would be defined as an essential family caregiver and what type of care services does that person then provide?
Sure, I'll be happy to. So I want to clarify a couple of very important issues. Both the federal and state guidance allows for compassionate care visits. So I encourage those that are listening or viewing to take a look at the September 17th memo from CMS, and that's also on our website under the link that I had previously mentioned, where the feds laid out some basic guidelines for compassionate care visits and gave examples of what should be included. The feds were very clear, clearly stated that the compassionate care is not limited to end of life issues, and compassionate care visits can continue throughout Tier 3 mitigation. The second point that I want to make is that the Illinois Department of Public Health, IDPH, recently released the Essential Caregiver Guidance that you're speaking of. And the Essential Caregiver Guidance, the essential caregivers aren't general visitors. These individuals meet an essential need for the resident by assisting with ADLs, which are the activities for daily living, or positively influencing the behavior of the resident. So the essential caregiver might assist a resident during meal times, provide supervision for a resident who's at risk of falls, or a variety of other tasks. An essential caregiver has to provide some level of care in order to fall into this category. The essential caregiver visit may continue through Tier 3 mitigation. IDPH did make that clarification last week on a call that we had. But it's up to the facility administrator and the director of nursing to determine if these visits are allowed.
Sure. So can you speak a little bit to the general visitor then? So if they're not an essential caregiver, then do they fall under the compassionate care piece, or like where does the general visitor come in then?
Well, the general visitor could come into play with the compassionate care piece, but again, it has to be something that they work with the facility on in terms of wanting to get in to see their loved one. The essential caregivers are a little bit different because they're working with the resident, like I said, with activities of daily living, whereas the general visitor would be someone maybe like an older granddaughter who wants to see their grandma or grandpa for the holiday or something like that, and just come and go. That person would be the general visitor. And because of the COVID infections in the communities, the facilities have really been limiting the general visitation. So if there are opportunities for a loved one or a family member or a close friend who wants to help support the resident in this way as an essential caregiver, they definitely can do so.
Yeah, thank you.
Thank you, Ombudsman Richards. And all for you that are joining us, just a real visit. This is AARP Illinois with Courtney Hederman, myself is Lori Hendren, and Illinois State Care Ombudsman Kelly Richards. And we're talking about essential caregivers and some of the newest guidance. For all your viewing, in our comments, we've already posted the direct link for the essential caregiver guidance, and then also the direct link for the Illinois Ombudsman's website. So you don't have to write it down. It's right there. You can click. So I want to get back to that comments about essential caregivers. I think this is very, very interesting. How or when will essential caregiver know when they can schedule the visit? I mean, you talk about an outbreak. So if my mother is in a nursing home, when will I know? How will I know I can go and schedule it? Is it upon me to call the nursing home? Do I have to wait for the guidance from the nursing home? How do I know?
Very good question. So IDPH has indicated that the facilities first need to come up with their own essential caregiver visitation policy. And then if a resident is interested in having a essential caregiver, the facility has to work with that resident and their family member or that friend that wants to participate as a essential caregiver. So there should be care planning involved in this process, and the resident should be at the core of it. So they need to find out what the resident wants, how they want to go about setting up this essential caregiver to come in. So it must be like a multidisciplinary approach that is used, and it has to be on a case-by-case situation.
Okay, Ombudsman Richards, I do have a follow-up question to that. What happens if your loved one is in a nursing home and is limited verbally, can't truly speak, and they cannot proactively ask or know? What happens in that essential for, you have a family, let's say a daughter who is a primary family caregiver coming in and feeding her mother, staying with her all day, giving her baths, just around the clock care, but that loved one can't ask. What happens then?
Well, in those situations where the resident can't communicate that they want to have an essential caregiver, then you would need to lean on the agent or the power of attorney or the guardian to make that decision for someone that can't articulate what their needs are. And for our program, that's typically what we do. If we have a resident that cannot direct us, we then move on to that agent, power of attorney, or guardian, that can provide direction in terms of what they would consider the resident would be wanting if they couldn't communicate that.
Okay. And so I want to go back to the idea of scheduling. I know we've heard, AARP Courtney and I've heard, it has been very hard for loved ones, folks in nursing homes, to get communication with them. And so the idea to just schedule that could be a real challenging and stressful ordeal. So who sets the schedule? And I apologize if you've already said it. Who sets the schedule for the essential caregiver visit in the facility? Is it the nursing home? Is it caregiver? How do you navigate that to be able to get in and see your loved one?
Yes, certainly. It's the nursing facility. So
Okay.
again, IDPH has indicated that the administrator and the director of nursing are the ones that would be making this determination. So in concert with those two individuals, the resident and their family member, or if the resident could not direct and communicate, the family member would need to touch bases with the administrator and the director of nursing to let them know that, Kelly, would want to be an essential caregiver. And if they run into any problems trying to connect with the facility, of course, you can always reach out to your local ombudsman, because that's what we do.
Wonderful. Well, thank you. And for those of you who are joining us, my name is Lori Hendren, along with my esteemed colleague, Courtney Hederman, and we're AARP Illinois. And also we have the privilege and the knowledge to be with Illinois State Long-Term Care Ombudsman Kelly Richards. I do want to bring back up this number, very important. This is the contact number to reach out for the Illinois Long-Term Care Ombudsman. So if you're joining us, please put your comments, we're monitoring it, or questions for the Long-Term Care Ombudsman in your feeds, and we're going to be getting to those.
Yeah, so thank you both. This is really a great conversation so far. So let's just switch gear for a second as it relates specifically to COVID-19 and how it really has devastated millions of families. AARP, we really tried to be a trusted resource for connecting Americans 50 plus with information, particularly about vaccines, so they can decide what's best for themselves and their families. AARP really does believe that vaccines must be safe, effective, free to consumers, and widely accessible. In fact, AARP has called for increased funding for vaccine development, production, distribution, so that any American who wants to get vaccinated can do so. AARP has also been providing information about the vaccine development process, the safety and effectiveness of vaccines, and how they will be distributed. Okay, so here's my question, Ombudsman Richards. So can you share with our viewers what is happening now in Illinois nursing home for Illinois residents regarding the COVID-19 vaccine? We obviously know that there's one that's available. We know there's another one that's about to be available. There's distribution that's likely happening. So can you share a little bit about Illinois nursing homes and how it's going to affect residents?
Sure, I would be delighted to. So the state is working to distribute many vaccines as they can do efficiently as possible. It's unrealistic for us to think that there won't be hiccups along the way, but I'm encouraged that the vaccines are finally here, and thrilled the residents of long-term care facilities have been prioritized to receive the vaccines. Facilities must have consent in order to vaccinate a resident, and the residents do have the right to refuse that vaccine. There's still a lot of unknowns about how the impact of the vaccinations will play out over the next several months. We're awaiting CDC guidance in terms of what the lifting of the restrictions might look like once residents and staff have been vaccinated. So, like, for example, there are questions about whether group activities can commence once residents and staff receive vaccines. And, the reality is that even though the vaccine is finally here, it will still take a time for the vaccine to get to every facility. We have like 1,600 facilities throughout the state. And so they're starting with the skilled nursing facilities and the intermediate care facilities in their rollout. And that's going to take about 6 weeks for them to get through all of those facilities. And then they'll move into the assisted living, the supportive living, the SMRFs.
That's great. Yeah. So just, go ahead. I'm sorry. Go ahead. Keep going.
I was just going to add one new thing, that since this is a new vaccine, we're likely going to see that visitation restrictions will still happen initially, because, like I said, residents don't have to, it's not a mandate for residents or for the facility staff to be vaccinated at this point. And they still want to make sure that we're following the proper protocol, so people will still be required to wear masks and stay 6 feet apart and exercise social distancing, even though they're rolling out the vaccinations.
Sure, that totally makes sense. So, whether someone wants their loved one to have the vaccine or not, what do you have you heard about a protocol? Should they be contacting, the nursing home facility saying yes, yes or no, I want this person vaccinated, and kind of that process a little bit that you know of?
Yeah, I mean, I must qualify this statement by saying that I don't know the ins and outs to what the facility's protocol is, but absolutely, if a resident or their, guardian or a healthcare power of attorney is interested in them getting vaccinated, there's consents that have to be signed or acknowledged as it relates to the vaccination. So absolutely, they would need to touch base with the facility in order to let them know that they are giving consent to be vaccinated for the COVID-19.
That makes sense. So if people might have a lot of questions, especially as this kind of rolls out. So where can they go for help?
I would imagine that, of course, I can always reach out to the local ombudsman. I'm always going to do shameless plug for the ombudsman program. But if they have more intricate kind of questions, I would advise them to reach out to the Illinois Department of Public Health or even their local health department.
Okay. Wonderful.
And the facility, of course.
All right. Well, thank you, Ombudsman Richards. Now, for all of you that are joining us, please continue to post your comments and questions. We've been talking a lot about essential caregivers, and we've got to thank you for the number. So I'm going to do another, keep that number up there because it is very helpful. So let's go to their questions. One of the questions we have is from a viewer. What options are available for family caregivers who are concerned about sending their loved ones to a long-term care facility or rehab facility during the pandemic?
I would say that they would need to, if they have concerns, they would need to reach out to the facility if they're interested in putting their loved one and ask questions. I think that education is important. People can always reach out to the Ombudsman program to ask specific questions. I mean, of course, we can't make referrals to specific facilities, but we can point people in the right direction as it relates to what they could generally expect or questions that they may have regarding putting their loved one into a nursing facility. Each facility has an admissions department or person, so they could definitely reach out to that person and ask specific questions that they may have, like, how are they dealing with COVID? What are their policies and procedures on visitation? Every facility should have that type of information and be able to share. There's information on IDPH's website in terms of facilities that are currently in outbreak status, if family members are interested in finding out if potential facilities that they're looking at are currently in outbreak status.
Okay, thank you. And a follow-up question. So when people are doing research regarding nursing homes, where's your advice? Where can people who are looking for the information? I know federal CMS does a ratings. What are resources we have? Is it through your office? So where does someone become educated as they start looking as that family caregiver, what our next steps are? Because in Illinois, we also have the community care program, which is a wonderful program that helps people stay in their homes. These are non-medical providers, but they help them age in the homestead and community, and it's a tremendous asset that we have in the state of Illinois. But then there's also long-term care. So where do you get information about long-term care?
Sure, certainly. So there are two things that the viewers can do. The Illinois Department on Aging has an ombudsman, has a consumer choice website, and it's under our ombudsman link. And I apologize, I can't remember where it is on our page. But if anyone is interested in getting more details about a facility and, more advanced searches, there is the Consumer Choice website that we have that consumers can go and compare facilities and look for specific things, like if They are looking for a facility that takes ex-offenders or has certain services, memory care, those types of things. They could find that information under the Consumer Choice website. And then, of course, the federal government has, and they just changed it, so I apologize. I want to say it's carecompare.gov, and I'm not certain about that, but they changed the name of their website that you can go to now to look for those types of things, Lori, that you were asking in terms of the ratings. But I will say to you that on the Consumer Choice website, we do have a link that will take you over to that page.
Okay, wonderful. And then for all the viewers, as she's been speaking, we have actually been tracking that and putting it in our comments. So you're going to have that direct link in our comments to that Consumer Choice that goes to the State Ombudsman for more information, and then also to the new federal CMS and the ratings of that. We're getting down to the end, but I got to go back to very important. I think the essential guidance is key for so many people who've not been able to see their loved ones. So I want to revisit that again. Give me the who, what, when, and how. How can you find out more information? Who does this apply to? Just the top line. And then I'm going to put your number up there as well, because people want to see their loved ones, but they need help.
Okay, so who this applies to in terms of essential care? Anyone that's interested in being an essential caregiver. That could be a daughter, a husband, a grandchild, a close family, a friend could request to be an essential caregiver. And again, that process is such that they would need to reach out to the facility, speak with the administrator, speak with the director of nursing. This must be care planned because it should be person-centered based on whatever those needs are for the resident, and begin to work together with the facility to try to set up the essential caregiver for that particular resident. In the IDPH guidance, they also outline the fact that the facility should be doing testing for the essential caregiver, similar to what they would do for a staff person. So essentially, the essential caregiver is somewhat taking over some of the responsibility of like the CNA in the facility, which will take a burden off of the staff. So it's a benefit to the facilities to work to get these essential caregivers established.
Thank you.
So, well, this has been a really informative discussion. I've learned so much. I'm so sorry, though, to say that we're near the end of our time for this live conversation. State Ombudsman Richards, do you have any other final comments before we close?
You know I do.
There you go.
I just want to encourage each and every one of you to reach out to your Ombudsman program if you have questions or concerns about your loved one in long-term care facilities. We know that this has been a very difficult time for all of us, but the level of difficulty, the hardship, the isolation has taken a tremendous toll on the residents in long-term care facilities. And I want to encourage you to stay engaged. Don't give up trying to connect with the ones that you know that are living in long-term care facilities. Make a telephone call, send a card, color a picture, drop it off, do virtual visits. Find out where you can send an email, conduct the window visits. We've taken a major step forward with the essential caregiver guidance, and I'm thrilled that it's out there. And we know the general visitation is not allowed in a lot of facilities because of the COVID outbreak, and we need each of us to do our part to try to push back against this feeling of isolation for the residents.
Thank you so much. Thank you so much, State Ombudsman Richards. You're a wealth of information, and I can't wait for us to have another conversation again. Thank you. And thank you, AARP members, volunteers, listeners, for joining in this discussion. We apologize if we were not able to answer your question or address your comments this morning, but I promise you we will be, again, looking to do more of this. Look for our next AARP Illinois live event on aarp.org/IL. As always, we'll focus on your comments and questions and get as many of those as possible. Lori, any other parting words?
No, this has been it's so informative, and I thank you. I know we have just thousands of family caregivers who desperately want to see their loved ones, and I think this is a wonderful holiday gift to be able to connect. And I thank you. I thank you for the work you're doing, and I applaud all of the staff that are out there just doing everything they can to keep our loved ones. And I have to say, AARP Illinois, talking about isolation, we have proudly sent over 1,600 cards to nursing home residents in the state of Illinois. Our staff and our volunteers from tip of the state to the bottom to connect. And what a powerful, we just got some powerful messages. So I just thank all of our team and just everyone. So thank you very much.
Thank you.
Thank you. Happy holidays.
All right. Thank you, everyone. This concludes our segment. Have a great weekend.
Bye-bye.